Press the bell icon on the YouTube app and never miss another update.
In a heavily cited article published in the Journal of Western Medicine, Dr. John Baldwin had stated bluntly that healthcare is not a business but an investment. Think of this in terms of an example. A business model is made purely for the gain of profit. Now think of patients with chronic illnesses like tuberculosis, leprosy, diabetes, cancers, and HIV/AIDS. Think of poor patients. Do you think these patients can ever repay enough to make their caregiving profitable? The answer is obviously no. Greetings viewers. This week on Healthcare Insights, I attempt to give you a peek into the Indian healthcare system, its key components and statistical facts so as to understand the healthcare system in a deeper way than we already do. Now before I plunge into the Indian scenario, let's look at the different types of healthcare systems that exist across the world. It all boils down to two factors: the type of healthcare and the type of health insurance. With healthcare, it can either be 100% government funded, which we know as public healthcare. With insurance, you could either have private insurance or public insurance or both, and then you have the private healthcare setup. Now, based on these tenets, you have 5 different systems. The first strata has countries with a universal government funded healthcare system, or single payer systems as we call them. Simply put, these are free for all citizens regardless of income and are funded completely by the tax payroll of a country. The examples are the United Kingdom with its famous National Health Service or NHS, some of the European Union and Australia. This is often touted as the most efficient and the ideal healthcare system. The next strata has countries with a universal public health insurance system. A part of each citizen's salary is deducted at source and converted into a social insurance. Russia, China and Japan follow this system, which is again very, very efficient. The next two systems are where you have a unique or universal private insurance system or a combination of both public and private insurance. The fifth system, which is considered as the least effective and the most chaotic one by economists, is unfortunately the one that we follow. Even the United States follows this system, just to add to this, with public coverage from Medicare and Medicaid and private insurance. Now, this is one of the few developed countries, when I speak of the US, that lacks a universal healthcare program. This is a system where non-universal insurance. We have both the government hospitals and private healthcare setups, and a combination of subsidized public insurance, private insurance, and for many, no health insurance at all. Now, one of the major things that sets the Indian healthcare system apart from other systems is also that constitutionally, the onus and the responsibility of healthcare rests with the state rather than the center. This leads to far more chaos, more non-uniformity and a lot of heterogeneity when it occurs between state to state. For example, Kerala advocates more resources towards healthcare, and it showed us last year when they combated the Nipah virus outbreak with alacrity, and even COVID-19 this year for that matter. Compare this with the relatively less advanced healthcare systems in North India and you'll see what I mean. Our national health policy was last revised in 2017, and the focus point was to uplift the face of public health in India so as to achieve 3 primary aims: to meet everybody's needs, to treat based on clinical need rather than ability to pay, and to be all-inclusive and free at the point of delivery. Though this public health model looks robust on paper, it hasn't really launched off in the real world despite the public-private partnership initiative. As of 2020, the private healthcare sector still rules the roost and caters to the majority of the healthcare in India in lieu of the public health sector. Now let's look at how our insurance systems work. As most of you are aware, the Ayushman Bharat Yojana, which was previously called the Prime Minister Jan Arogya Yojana, was launched in 2018. Despite that, most of the expenditure in the private healthcare setup is still borne by the patient himself or herself, which is called an out-of-pocket expenditure. This is not covered by insurance. And while this may change in the near future, this is how it stands at present. Let's move on to hospitals. In India, hospitals may be run by the government, by charitable organizations which are similar to non-profit organizations except for the tax rebate part, and by private organizations. So you have public, private, government funded and non-profit. Now, we have various disciplines in our country, medicine disciplines that is. We have modern medicine or allopathy, we have traditional medicine and indigenous medicine systems like Ayush, which is nothing but Ayurveda, Yoga, Unani, Siddha and homeopathy. There is a huge need gap in healthcare in the Indian system between the outreach, the finance and access, which needs to be looked into urgently. This is currently being managed under the National Urban Health Mission for cities and the National Rural Health Mission for rural areas. The major healthcare centers exist usually in urban areas, and conglomerates of rural areas have primary health centers or PHCs. It is common knowledge that PHCs have, they are not well equipped, largely due to the scarcity of human and non-human resources. Which is what drives people to seek private healthcare even in the rural areas, often with no insurance, like I mentioned before. And even the care subsidy exists only for people who are below the poverty line. Which is to reiterate that, the healthcare system in India is lacking when it comes to the public sector. To put things very simply and lucidly, not enough of the gross domestic product or the GDP, which is like a country's economic footprint, is being pumped into the public healthcare system in India. Remember when I told you that both India and the US have non-universal healthcare programs, essentially the same healthcare system, but the US fares far better than us in terms of efficient healthcare systems. Just a fact, the US is ranked 37th on the list, where India is 177th out of 190 countries. The big difference herein lies in the GDP being allocated towards healthcare. In the United States, a whopping 17.06% of the GDP is allocated to health expenditure as compared to a measly 3.53% by us. And of the 3.53%, only 1.28% goes towards public health. This is not to say that we're poor by any stretch of imagination. We are in fact 5th on the list of GDP if you go by country. We share 4% of the world's GDP. But in terms of healthcare contribution, we are at a disappointing rank of 170 amongst 188 countries as per the last WHO Global Health Expenditure Report. Countries who are much poorer than us invest more in healthcare than we do. Take the example of Afghanistan. They spend 11.7% of their GDP towards health expenditure, and this is as per the World Bank report of 2017. There's an Organization for Economic Development and Cooperation, the OECD, which is a group of countries that deal with intergovernmental economization. Even out of that, the average spends towards healthcare are 8.8%, while we are still only at 3.53%, again at the bottom of the list of 37 countries. 3.53% is alarmingly low towards the healthcare sector, considering that services, the service sector, is allotted the biggest chunk of the GDP, which is approximately 53%, followed by industries, which get under 30%, and agriculture, which gets the lowest, around 17%. To put things into perspective, of all the GDP allocated to services, which form the backbone of GDP in India, healthcare services receive only 18%. If you compare this to hospitality, transport, communication, military, finance, trade, administration and other services, this is very low. The current coronavirus pandemic has spawned a global healthcare collapse even in the most developed of healthcare systems. Fortunately, we have seen nearly 3.8% of the GDP being pumped into both public and private health sectors right now to offset the sequelae. The budget allocation towards Ministry of Health and Family Welfare for the current financial year is 65,000 crore rupees. But this trend needs to become a norm rather than just an exception. Healthcare needs to be treated like we treat education, a national investment rather than a business. Because if and when the pandemic is over, we still have a humongous, ever-increasing burden of non-communicable and lifestyle diseases to tackle. Let COVID-19 teach us this one lesson. Healthcare has to feature among a country's topmost priorities. That's the only way for a nation to progress. And the only way forward would be to prioritize healthcare, mobilize funds, and revive our ravaged healthcare system. Until next week, this is your host, Aseem Sharma, signing off. Take care, stay safe, keep fighting COVID, and see you soon.